Normally, we see a big push around this time of the year in February about healthy hearts, but this year so much focus has been on the virus that a lot of people are letting their heart and their other health issues take a back seat. Dr. Shalini Modi with us here. She's the chief of cardiology over at Henry Ford West Bloomfield Hospital. Great to have you with us.
Thank you so much for this opportunity.
I am so so blessed to have you on. I had a girlfriend who went in for a checkup, and they had to admit her to the hospital right away because she was having issues that, had she not been in for the checkup, may have been devastating consequences. Talk a little bit about our hearts and being healthy and trying to manage it all in the middle of a pandemic as well.
Yes, you absolutely put it very well together. It's, when there's a lot of stress around us, we do not take care of ourselves very well, particularly women, because they are the anchors for the family. And, women tend to ignore their health in general, and particularly heart health. And many times, people can have silent heart attacks, silent events happen, and till you get it evaluated or be more aware of what has changed in your body and go and get some help, get physical, go and get some blood tests, it's very difficult to assess where things are. So somebody has to be very in tune with their body, and which means that somebody who exercises every day and knows that they cannot do some activity that they could do a week ago, then something changed inside them. But as you very well said earlier, that COVID affected everyone, and when people are not exercising, they're not eating right, ultimately, yes, hearts do get affected.
So what do we do? There are different signs for men and different signs for women. What should we be on the lookout for?
So, for going back to the 1930s, 40s, it was always portrayed heart disease being typically being in the men, the crushing sign with the fist clenched across their chest. But we know over the years, women are equally at risk. A lot of hormonal changes, and it's not just blockages, it's also the stress of these various hormones that play into during pregnancy for women. Women can get heart attacks as a process of other things other than blockages, which are caused just by cholesterol buildup. So there are a lot of other processes that we are finding out as a result of research and being more aware of it. And in terms of the differences in symptoms, women are known to have some very non-specific, such as fatigue or pain behind the shoulder blades or just back pain, heartburn. And men typically may not, they mostly have chest pain. So, and then, women are so busy, as I was telling you, as being anchors of their family, they just blow it off. They don't think it's worth getting any attention.
So I read somewhere that women in their midlife are at higher risk. Why is that?
So more and more of that, and particularly there's a lot of racial disparity in that, particularly in African American women. We're finding that it's 35 to 55. There's a lot of push, a lot of research being done by AHA to understand what that is in terms of, but it's believed that a lot has to do with undiagnosed hypertension, not getting care. All these are risk factors that ultimately lead to heart disease, so diabetes, high blood pressure, smoking. Smoking is one of the common reasons I will find young women who are, under the age of 50 presenting with heart attacks. So that's in our control. We should not be doing that. But diabetes, hypertension, high cholesterol, all these are modifiable risk factors. And if one does not seek timely, just ongoing medical care, seeing a primary care physician, then these all can be modified so that, bad event doesn't happen.
Dr. Modi with us here on the MegaCast. She's the chief of cardiology at Henry Ford West Bloomfield Hospital. What are some things that we can be doing to improve our heart health?
So heart health, the first and foremost thing I always like to talk about, there are things that are in our hand and the things which are not in our hands, the genetics, age, gender, we cannot change that. But there are a lot of things which are in our hands, and the biggest factors being diet, lifestyle, those are the main anchors to protect our hearts and to protect us from having heart attacks. And in addition, I always emphasize going and getting a yearly physical. So that's where you will get your blood draw. That's where a person would know whether they're getting pre-diabetic, whether they're getting diabetes, high blood pressure, high cholesterol. So all those can be tended to much earlier than after the fact.
It's better to take care of it prior than after. What changes have you seen in the public when it comes to addressing our hearts during the pandemic?
So the previous presenter and the discussion I thought was so relevant to my topic as well, because I completely agree with you. What I've seen even in my patient population has been an increase in weight. And there's fear and a lot of stress from the family members. So I think that has negatively impacted the overall health of our patients.
So we can try to get healthy. Will that also help with COVID? Because we do hear some people, I know the discussion in my family has been take more vitamins, exercise more, eat better because it will help you with COVID, but it could help you in all aspects of your life.
Absolutely. And, the importance of healthy diet. So if you recall, there were various diets, you would hear the term Mediterranean diet, which is heart healthy. There is the DASH diet. And most recently, there's been the MIND diet, which is mostly a combination of features of both the DASH as well as the Mediterranean, but more emphasis on fresh fruits and vegetables. And people are finding that it helps, delay in the onset of dementia. So all those things which we know, intuitively, we know they are good for us, but somehow we tend to, stray away from that. Just the ease, how busy everybody is, leaning towards processed food. We know that's not healthy. So eating right is the core. In terms of supplements, I think that's a very big industry, but the key is having a well-balanced diet, lots of greens and different colored of vegetables and fruits being represented in every meal and then couple that with exercise.
So when it comes to women and heart attacks, is there something that typically is missing from their diet that could help contribute to a heart attack?
When I interview my patients when they come out, I don't think it's one particular element in general. Everybody's so busy. They don't take time to plan their meals. Many times it's on the go. So it's basically a busy life. Unfortunately, there are people who have multiple jobs in a week, and everybody's working hard, and stress is a major factor. So meal planning would be very helpful, not a particular nutrient, but just taking a step back. And many times I'll tell them, plan your meals on the weekends, so then you're ready for the whole week.
What about some of those the home meal delivery services? Do you recommend those, or it's really whichever one you pick and choose from?
I think as long as there are no processed elements, it's still better. I have never used them, so I could not tell you. The two things I would tell you is if there are fresh ingredients and if the salt content is low, then there is nothing wrong with that. But many times, if they're using processed foods or processed sauces and things like that, that may translate to higher caloric food as well.
So with that, it's like read the labels, right?
Very important.
With that, Dr. Modi with us here on the MegaCast. She's the Chief of Cardiology at Henry Ford West Bloomfield Hospital. It's always great to have our experts on with us. Can you talk a little bit about COVID? Have you had any patients that are recovering from COVID-19 and the impact it's had on their hearts?
Yes. Unfortunately, as you know, during March, April, we saw a lot of COVID-related hospitalizations in our community, and some we lost. I think those were our older patients. It has a lot to do with their immunity, as we were talking about, but the effects, by and large, most people have had a very good recovery. We saw various effects of the virus on the heart. We saw infections. Something known as myocarditis, which is inflammation of the heart muscle. And in turn, we also saw a lot of arrhythmias. Many times I like to refer to our patients that the heart is like a house. So, there's the electrical system, there's a plumbing system, and the walls tell you, and the inflammation of the walls, a lot of that is what we were seeing. Then we were also seeing a lot of clots, this predisposition for thickening of the blood, clots inside the heart, people getting clots in their lungs. So a myriad of manifestations, which caught everyone by surprise, I think, just not nationally, internationally as well. Why is this happening? How do you treat it? And but I think we've gotten smarter and wiser.
So is the heart like a muscle, like our muscles, like where we do push-ups to get stronger? What can we do to make our heart stronger?
So that's it's an excellent analogy. And yes, and that's why we say exercise is great, because that's how we strengthen the muscle, is by exercising. So that really helps even our patients with congestive heart failure. And I wanted to tell you that here in our clinic at West Bloomfield, we have a myriad of specialists which deal with complex heart diseases. So for us being a community hospital, the things that we offer are far greater in terms of technology and the specialist care, which is right here in our community. And they will always say our advanced heart failure, physicians who are involved in cardiac transplants, now the procedure is done at Maine. But the key is, even our patients with heart failure, we would always like them to exercise. That is the most important thing.
So when they do exercise, like I know I have the Apple Watch, there are Fitbits out there. How important is it to watch your heart rate? And when do you know you're kind of in a danger zone?
So first and foremost, these electronic devices, we always take their numbers with a little grain of salt, how accurate they are. Let's say if this is somebody and patient who has somewhat of risk factors, and they're trying to get on an exercise regimen, many times it's not unreasonable to evaluate and come up with an exercise prescription heart rate for them based on how they perform on a stress test. But somebody who's younger, who does not have a lot of comorbidities, which we mean a lot of other risk factors, and they just want to exercise, we always say, go by how you feel. You should not push yourself, right? A little bit shortness of breath is to be expected, but your body really will tell you, and you should always be in tune with how you're feeling when you're exercising. Most of our patients, I always ask them, okay, so you exercise, right? And these are patients with blockages, by the way. How do you feel when you're done? Oh, I feel great. So, that is a good way of knowing. But yeah, somebody with a lot of risk factors, absolutely, it's better to be safe. We put them on a treadmill. We'll tell you, hey, this is where we want your heart rate to be. Particularly with patients who've had an event, right? Which is very scary for any patient who's had a heart attack or had, open heart surgery or valvular surgery. The question always is, how much do I exercise? And then they undergo a cardiac rehab in our rehab program here. And somewhere midway in the process, they will undergo a stress test. And based on that, we will advise them, this is where we want your heart rate to be.
Dr. Shalini Modi with us. She is the Chief of Cardiology at Henry Ford West Bloomfield Hospital. And Dr. Modi, I've heard from various people, whether they have a background in medicine or not, usually they don't, that having greater cardiovascular strength and having greater respiratory strength will help you with outcomes potentially if you do if you are afflicted with COVID-19. From what you and your colleagues at Henry Ford have noticed and have researched over the course of the pandemic, is there a correlation, is there a relationship between improved heart health and outcomes for COVID-19 for those that may be infected with the virus as this pandemic goes on?
Excellent question, Tyler. I would say that, in the earlier segment, I had mentioned the patients who did not do very well were limited in their reserves. And these were the patients who had other illnesses, maybe it would be lung disease underlying, who just did not have, the enough immunity to overcome the infection. Because there are many ways that COVID affects the heart and the ability to fight something so stressful. In fact, not just COVID, I would say for any human being, if they are in good cardiorespiratory status, the ability to go through any stresses, for example, any major surgeries, they're in better off condition any major illness that may come their way. So it is very important.
And Dr. Modi, following up on that, for those that may be not taking COVID as seriously or may not see it as much of a serious affliction as it is, how are some of those ways that COVID-19 does affect the heart while you are afflicted with the disease, and as far as the medical community knows, afterward?
No, the worst thing is death, right?
Yeah.
And this is what we saw. It is sad to hear people who were in their 70s dying because of COVID, and be it their delay in their presentation or because people were scared to come to the hospital at that time. So I think prevention, wearing the mask, is such an important message that we all have to do as a community. Even in our hospital, we're all immunized, but nevertheless, we all wear masks. Dealing with everyone, and that is the best thing we can do. So not only for COVID, but as you all know, we have all these variants of the virus coming, all across the globe, and we must take this precaution. And it's such a simple thing to protect ourselves as well as our families.
Dr. Modi with us here on the MegaCast. She's the Chief of Cardiology at Henry Ford West Bloomfield Hospital. Anything maybe you want to touch on before we say goodbye for the day?
Yes, I first of all want to thank the organizers for giving me this wonderful opportunity. I quickly want to share with you what this hospital believes in and what our department does. We believe in taking care of the people in the community. We appreciate all the support we get in this community. And as I had mentioned earlier, that yes, we are a community hospital, but when we see all the the innovative procedures that can be offered, they're far greater than any other community hospital. We were talking about prevention of heart disease. We do so much in non-invasive imaging, CT of the hearts, the MRIs of the hearts, PET scans. We are the only Henry Ford hospital that offers cardiac PETs here. And then our cath lab, all the new procedures, complex patients who come in with heart attacks, we're able to take care of them. The EP device clinic, and the EP procedures, which is putting pacemakers in patients with arrhythmias, we're able to take care of that as well. And even in the outpatient setting, we have complex clinics, taking care of sarcoid patients, adult congenital, structural heart, name it. And I'm just for me, it's a privilege to be a part of Henry Ford and work here at West Bloomfield.
Well, it's a privilege to have the hospital in our community. You've been great partners here on Civic Center TV, helping us navigate this crazy world that we've been in and helping the community as well. So we appreciate all of you over there at Henry Ford West Bloomfield. And
one last word, we wouldn't be here if we wouldn't think with the same importance about our brain patients, the stroke patients. And I do know that, which is represented by the neurology department, they're so important for our community as well. So,
well, thank you again for your time. We so appreciate it.
Thank you. Appreciate